Dr. Sandra Wainwright is a perfect example of how Norwalk Hospital is helping its communities. She is simultaneously utilizing the newest technologies and mentoring the next generation of her hospital team. Dr. Wainwright is leading the charge in modern healthcare.
I'm Sandra Wainwright, and I'm in the pulmonary department at Norwalk Hospital. I am an employed hospital physician, and I'm also a teaching doctor. And in my teaching role, what I do is we see patients together. So he has a left-sided pleural effusion, and we're not sure if it's loculated or not. So why don't we throw an ultrasound on there and see if we can see any septations? And we discuss other interesting patients together as well, and begin to develop that pattern recognition that clinicians need to be the specialists and the experts that they're going to grow up to be when they're done with their training. And so we sort of mentor them through that process while we're delivering care to the patient. The biggest pocket of fluid is we could take that fluid pocket out safely with a needle. And I did not even know that Norwalk Hospital existed when I was a medical student and looking for residency programs. I was on the student government council for my medical school and was back at my medical school in Grenada. I went to St. George's University, and we cut off this gentleman in line at the airport. It turns out that he was the program director here at Norwalk Hospital for the internal medicine program. And he approached us and he said, "Why don't you come to Norwalk?" So we did. And I just fell in love with the place. The first thing I noticed were the floors were shiny and clean, and people were friendly. Everybody says hi to each other here. The people who transport the patients, the people who are responsible for keeping the hospital tidy. We say hi to each other, and we're like an extended family. And you can feel that when you walk into this hospital. The purity of talking to a patient is that human-to-human interaction between the physician that wants to help and the patient that needs that help. It's that community feel where you sit down by the patient's bed and you know where they live when they describe, "I'm on that street next to the CVS." You can visualize where their home is, and you can see what their social situation must be. And maybe you even know who their neighbor is because you're sort of a town doctor. And when you connect that human interaction with the science and technology background that you were given by working in an academic institution, I think that's the best individualized care that you can get. So when I was a child, I used to watch Star Trek, and when Dr. McCoy or Bones or whatever his name was would take care of the patient, he would take out the tricorder device and scan the patient and be able to know immediately what was wrong with him or her. Here we use a bedside ultrasound technique. This mobile ultrasound device has now the technology to have decent screen resolution, decent memory, decent imaging, that we can actually have some meaningful diagnostic bedside efforts.
So again, when you take a deep breath, you see that moving there? That's your diaphragm moving down?
Yeah.
So now our pulmonary fellows carry this device around and they put it on the patient's chest right there when they're seeing them, and we can more quickly decide what the next step is going to be. Do we put a needle in and drain the fluid out? Do we need to call the surgeon in because it's a more complicated fluid than we thought? Or it's just a garden variety pneumonia. So we can often enhance our ability to diagnose and more rapidly pick the right treatment for that patient based on this mobile technology. Part of our team approach here at Norwalk is that we have an amazing thoracic oncology program. We meet as a group with the radiation oncologist, our oncologists, the pathologist, the radiologist, and the thoracic surgeons. And we put all of our collective brains together. We are doing genetic testing to a significant level that's greater than some of the major cancer centers in the area, and we're able to give our cancer patients the latest technology and guide them appropriately to their next treatment protocol, and put them into whatever experimental treatment regimens they need to based on that enhanced genetic information that we get for them. I think that both Danbury and Norwalk hospitals are continuing to support physicians in the community who want to live and work in the same place, and supporting the community itself and its needs. Not only do we support the community in which we're situated, the community supports the hospitals too. Danbury and Norwalk together really have their finger on the pulse of the home in which they live. We know our people, we know what their needs are, and we continue to look out for their health now, their health in the future, and the generations that come afterwards.